All right. One of my colleagues who runs a SAMHSA center, Angela Weeks, is going to be joining us today. If you were lucky enough to be here when she talked the first time, you'll know that she has lots of data and lots of stats to help push us along to make things better for this population. And I'm really looking forward to hearing from her today.
Thank you, Amy. I'm really glad to be here. Oh, I see we have this slide next. Go
Yeah,
ahead, Amy.
I'm going to come back to you in a minute, but
Okay.
I'm really thrilled you're here. So we remember everybody who's on this call, new, old, etc. Remember, you can always find out who's coming up next week by going to our website. And also you can find out what you missed last week. If you happen to be out, you can view old materials. Sometimes I'm like, wait, what was that stat that they said? And I want to share it with somebody. I just go here because I can see all the slides. I can see everything. And if I'm going to be out, I can catch up on what I've missed. Things from NASHBIT are here, things about legislation are here, all kinds of information's here. So always go to our crisisnow.com. All right. Along with Angela Weeks, who's going to be featured for a second time today, we've had so many unique speakers here, over 400. And as I said before the top of the hour, we're always looking for new movers and shakers, needle movers, people who are really making a difference out there around crisis services. If you've got somebody, or we've had somebody, but it's been quite a while and you'd love to hear from them again, let us know. We're in constant communication with you, our audience, to make sure that what we're doing is timely and relevant to the work that the country's doing to move things forward. All right, 3 news stories today. And I just want to start this news story part, and we're going to do some hot seat and then talk to Angela. You know, today's topic is heavy, right? Because we still have a lot of work to do in this area. So I don't want you to leave today with the heaviness. I want you to leave with a call to action. All right. This is a call to action for things that we need to pay attention to and we need to change. So here was an article that 36% of LGBTQ youth say they don't expect to live to age 35. You may have a kid who's less than 35. You may be younger than 35, or at one point you were 35. Imagine not being seen beyond that, how horrible that is. So we need to change that. We need to change that outlook. Also, rising suicide rates were in the news this week from Hispanics worries about Hispanics feeling suicidal, right? And there was the extra burden that some of the children in such families were doing a lot of communication for the adults who might feel suicidal because they didn't have a language responsive place to go. We're changing that with 988, but just know that this is another group where we need to pay special attention to. And lastly, this was a bit of really good news. In face of student mental health crisis, the New York City Council really wants to expand peer-to-peer support. And we've heard this on this call over and over and over again, and many of us have worked in places, and we know the value of peers. It's irreplaceable. And whether that's a peer in terms of life experience, diagnosis, age, the way they look, anything, we know that nothing replaces someone who looks like us and understands us deeply. And so this was a thrilling thing to see that the New York City Council is really designating that as a priority. And I appreciated that. All right. The hot seat. I love to be the hot seat moderator. I hate to be in the hot seat. Today I'm going to be in the hot seat with all of you. We're all going to be in it today. And I know this group is going to do great. So let's look at our question and let's put our heads together. Remember, you're going to put your answer in the poll. Studies show that LGBTQ plus individuals are at a higher risk for mental health issues compared to their heterosexual and cisgender counterparts. So here's the question. Which of the following factors has been identified as a significant contributor to mental health disparities within the LGBTQ community? So what's contributed to the disparities? Let's put in our answer. Okay, I've submitted mine. I hope you've submitted yours. And let's see what this brain power comes up with. All right. Split, but the highest was 55%. More than half of you said that the contributor to mental health disparities for the LGBTQ community is really experiences that they have around discrimination and stigma. So let's find out how we did. Oh, yes, just as I predicted, the brain power here of this audience is we got it right. So societal stigma and discrimination can lead to feelings of rejection, isolation, internalized homophobia, and transphobia. These stressors impact mental well-being, contributing to higher rates of depression, anxiety, substance use, and suicidal ideation compared to the general population. And this is why we've invited Angela today, is because she's going to help us think through how we can help this group. All right. Congratulations, Jammers. So proud of you. I know David would be proud of us that we got it right. Good work. All right. So Angela, so excited to see you. And I love the pink shirt. Wonderful. I'm going to hand it over to you. I'd love to hear from you.
Wonderful. Thanks, Amy. As I said earlier, really glad to be here and be part of the group and being able to contribute to the conversation. In the first session I did, I talked about general disparities and some of the unique experiences that LGBTQ plus people navigate that, folks in this space that are providing services should pay attention to, should get a little bit of training on. And so this time I'm digging into current events. There's a lot going on across the country right now that's impacting this population. So I wanted to take a moment to talk about that. Again, my name is Angela Weeks. My pronouns are she and her, and I'm the director of the National SOGI Center. And also project director for the Center of Excellence on LGBTQ plus behavioral health equity. Next slide. So as mentioned earlier, today is the International Day of Pink. This is set up as an international day against bullying, discrimination, homophobia, transphobia, and transmisogyny in cities and towns across the world. And on this day, everyone is invited to celebrate diversity by wearing a pink shirt or pink anything really, and by organizing activities in their workplace, schools, and communities in support of the day to really raise awareness about bullying towards this population. And it started in Nova Scotia, Canada, when a couple of high school students witnessed a fellow student who was gay being bullied for wearing a pink shirt. And they intervened in the moment, but then they went beyond that and decided to wear pink to school the next day. And from there, they started organizing at the school for lots and lots of students to wear pink in response to anti-bullying efforts. And the school was really taken back by the students' support and how they showed up for the topic. So they started organizing at the school and actually changing policies and centering this conversation. And so it just spread from there. And so lots and lots of organizations acknowledge it and celebrate or organize events around it. Also on this Friday of this week, there is a day of silence where students spread awareness about LGBTQ plus bullying by taking a vow of silence for the day in their schools and communities. So there's just a lot of stuff going on this week. That's great to highlight. Next slide. As Amy said, I bring a lot of data, so I'll be talking about recent data that show depression and suicidality rates with this population, and it is heavy. And so, I just want to echo what Amy said, that hopefully at the end of this, there's a call to action and folks can make a plan for how they're going to show up and support and spread the message. So some current mental health data. A 2022 report by the Trevor Project, which is a nonprofit focused on suicide prevention, revealed that 45% of LGBTQ plus people aged 13 to 24 considered attempting suicide the previous year. So almost half the population. And almost 20% of transgender and non-binary young people actually tried to end their lives. Next slide. And then LGBTQ youth who held more marginalized identities reported greater risk to suicide compared to their peers from the same report, Trevor Project 2022. Next slide. And so diving in a little bit to see what this looks like by subgroup within the population, there's a great report published by Child Trends that talks about LGBT youth reporting suicide attempts 5 times, where they reported them 5 times more often than their straight peers, and that Black girls and women were among the groups with the highest percentage of reported suicide attempts. Next slide. And digging into another aspect of the multiple identities that we carry, the percentage of LGBTQ plus youth with multiple disabilities who reported a suicide attempt in the past 12 months from the same study was nearly 8 times higher than the percentage of LGBTQ youth with no disabilities who reported a suicide attempt. So that's a pretty remarkable jump for that population. Next slide. And so there's a lot of things that contribute to higher rates of depression and increased anxiety and suicidality among LGBTQ plus populations. And right now, there is almost an epidemic of anti-LGBTQ laws and climates that are spreading rapidly and have been spreading rapidly for the last few years across the country and even internationally. But we'll focus on the US for now. And so the ACLU, which is the American Civil Liberties Union, is actually tracking 484 anti-LGBTQ bills in the US during this legislative session. So what you're looking at here is a map that was updated in April of 2024. And the darker the state is, the more anti-LGBTQ bills are proposed. It doesn't mean that these gray states don't have them. They certainly do. Texas has several anti-LGBTQ bans, for example. California and even some of the states we consider more LGBTQ friendly certainly have lots of bills that have been introduced, whether they've been picked up or not. And so that's important to think about, because we often think that this is very state specific, this climate, but actually the climate is impacting everyone regardless of the state you're in, sometimes more than others. But folks that are in California and New York and some of the more LGBTQ friendly states are still impacted by the anti-LGBTQ climate, because within those states, there are pockets of anti-LGBTQ climates. And watching an element of your identity and your life experience being debated on a national scale in the news, on social media, the internet, even knowing that there is so much support sometimes for some of these anti-LGBTQ bills can have a really negative impact on mental health. Next slide, please. So what do these bills do? They're all sometimes very similar to each other, and sometimes they have different flavors. But for the most part, the bills are aimed at legalizing discrimination against transgender people by narrowing the definition of gender discrimination. The bills also could focus on censoring curriculum, so taking out LGBTQ plus historical figures, or making health education non-inclusive of LGBTQ people. There's also bills that focus on banning transgender youth from sports and gender affirming facilities. There are some that force school professionals to out an LGBTQ young person to their families, which can be very dangerous because often school professionals don't have a sense of what the climate is like in that household. And so by outing the young person without their permission could be putting them at some severe risk. There's also bans that block gender affirming care. So in other words, usually these are targeted towards minors that prevent them from accessing things like puberty blockers or gender affirming hormone treatment. There's also many bills that ban the display of pride flags, and also some that ban name changes on legal documents. Next slide. So all of this, the bills, the anti-LGBTQ climates, has led to higher rates of violence towards LGBTQ plus people. We see this in the data. The number of reported LGBTQ plus hate crimes committed at schools more than doubled between 2018 and 2022, particularly in states like Florida, Georgia, Oklahoma, and Texas, which have anti-LGBTQ plus laws, many of them. Transgender and non-binary students in particular are more likely to be harassed and assaulted today than they were 5 years ago. Next slide. So as important as it is for us to understand some of the things contributing to negative health outcomes, it is equally important for us to understand what helps, right? And we do have quite a bit of data that shows what helps. So we know that supportive families act as a buffer, an incredible buffer against suicidal ideation. And likewise, unsupportive families significantly predict the likelihood of suicide attempts for transgender people and really LGBTQ people in general. And so it's really important that we focus our own learning and education and skills around how to support families who may have challenges around this topic, may have questions when their LGBTQ child comes out to them. The next one is parental social support was significantly associated. Hopefully I'm freezing on my end. I hope I'm not freezing for everyone else. Parental social support was significantly associated with youth depressive symptoms, such as higher perceived support with fewer depressive symptoms. So again, another study that's showing that parental support is really important. Another one we don't often think about is support within schools. And so LGBTQ middle and high school students with access to at least one school-related factor, like a gender and sexuality alliance group, gender-neutral bathrooms at school, teachers who respected pronouns, inclusive sexual and historical education had 26% lower odds of attempting suicide in the past year, according to the the 2023 Trevor Project report. And in a study of 104 transgender and non-binary youth, researchers observed 60% lower odds of depression and 73% lower odds of suicidality among youths who had initiated puberty blockers or gender affirming hormone therapy compared with youth that did not. So this is just a sample of the research out there that shows that support is incredibly important to the well-being of this population. And my call to action to everyone here would be to share this information widely. When you hear misinformation at work from loved ones, please share this data. This is so important to advancing our understanding about the population and what's going to help support. So with that is the end of my presentation here, Amy. Thanks for giving me the time.
Angela, a pleasure as usual. And although you were freezing all of your words, we heard every single thing. So sometimes it didn't totally match your mouth, but we heard all the words. So really appreciate that. So I want to bring forward our two discussants today. I'm really excited to have Lindsay Smith here and also Elliot Hinkle. So I'll bring them forward and we're going to start with Lindsay. Welcome. So happy to have you today on the Jam.
Hi, everyone. It's great to see you. I'm so happy to be here and thank you so much for having me. My name is Lindsay Smith. My pronouns are she, her, and I am a training manager at the Center of Excellence on LGBTQ plus behavioral health equity. So what I would like to do today is share a few of my favorite resources and learning opportunities that we have going on. And Angela will be sharing links in the chat to the items that I mentioned. So we have a webinar series where we do a few webinars every month that are live. We also house them in a recorded format on our website. And we also create animations and e-learning modules. So the first thing that I want to mention is an animated short, which is called Providing Equitable and Affirming Care to LGBTQ plus Older Adults. This is a collaboration between the Center of Excellence and the E4 Center of Excellence for Behavioral Health Disparities in Aging. And this talks about some specific unique challenges that LGBTQ plus older adults face related to historical trauma and some of the historical and societal times that they have lived through, as well as challenges related to aging and the aging process and receiving care in nursing homes or hospitals or other facilities where it can be much more challenging in terms of coming out or having providers aware of their needs, dealing with discrimination on a whole new level. So definitely check that one out. Another item that I'd like to spotlight is actually a virtual interactive self-paced e-learning module that we created specifically for 988 crisis counselors. So that is Introduction to LGBTQ plus populations of special considerations for 988 Suicide Crisis Lifeline. This was created in partnership with Vibrant Emotional Health. And what this does, it has some information about the LGBTQ community and disparities that can relate to special consideration and support for LGBTQ folks from 988 crisis counselors. And it also has interactive scenarios, talks about mental health considerations, the coming out process, and then just really some ways that 988 crisis counselors can support LGBTQ people over call, chat, text. It's 60 minutes long, and it does have continuing education credits available. All of these resources are totally free that I am sharing today, by the way. So in addition to the webinars, e-learnings, and animations, we also have a wealth of resources on our website in the forms of infographics, tip sheets, and a few that are a little bit longer than tip sheets. There are a lot of different formats around several different topics for really supporting the population. Definitely check out our website at lgbtqequity.org to learn some more information and see just really the wealth of things that we have to offer. But a few of my favorite resources, one of them is called Important Tips for Supporting Families of LGBTQ plus people. So this is also a tool that was created in partnership with the National Center for Families. And what it talks about is the impact of support from families and how that impacts LGBTQ loved ones, in reducing anxiety and depression, suicidal ideation, harmful substance use. And it talks about just sometimes how families can struggle and how you can work with those families and really provide non-judgmental spaces for them to seek support while also connecting them to resources that will improve their ability to really affirm their young person's LGBTQ identity. So definitely check this one out. And another tool that I would like to share is called Minority Stress and Coping for LGBTQ plus Adolescent Health. So, you saw some from the research that was shared earlier today, how LGBTQ adolescents are at a heightened risk for many behavioral outcomes, including substance misuse. And a lot of research really shows that these experiences can be tied to discrimination known as minority stress for LGBTQ folks. And so one thing about this resource is it talks about the impact of minority stress on LGBTQ plus young people, but it also provides some conversation starters that can be used in working with young people around these topics. So for example, just one of these that I will share quickly, looking at the minority stressor of social marginalization, then companion piece to that is there's a conversation starter that is, what do you know about LGBTQ plus history? And where do you find community when you need support? So these are really easy ways that you can take and use in your work with LGBTQ young people who might be experiencing minority stress. Another one of my favorite resources that we have put out is called 10 self-care tips for providers working with LGBTQ plus clients. So of course, self-care is always important. We talk a lot about self-care. And so we thought, we've heard from folks that we work with in the field, how, it would be important to create a tool speaking specifically to self-care for behavioral health professionals who are providing care for LGBTQ plus folks that are experiencing bias, racism, and other forms of discrimination and injustice. So what this talks about is just some tips, things that we need to take into consideration, especially when really working with a population that experiences so much discrimination. So that's definitely another great one to check out. And finally, to wrap up, I want to talk about 2 quick ways that you can connect with us and continue on this journey with us and get some updates about things we have going on. First one is technical assistance. We offer up to 8 free hours of technical assistance per year for any organization who provides behavioral health services. So if you are trying to figure out where to start in this work to improve outcomes for the young people you work with, or LGBTQ folks of all ages that you work with, or maybe you've had trainings in the past and you're really wondering where the next steps are to take this work a little further in your organization and with your colleagues, using this opportunity of free technical assistance is a great way to just get some one-on-one, talk through some issues that are happening and get that those opportunities laid out. So the other final way is to sign up for our newsletter. So this comes out every month and it shares the latest webinars, other learning opportunities, resources and tools as soon as they come out when we release them. Those are the first place they go as soon as they're going up on our website. So please sign up and follow along with us. You can catch all the latest things that are happening. And also, it's a little early to say anything yet, but I will say that we are working on a special series for Pride Month this year for June. And so you would definitely want to sign up before Pride Month comes so that you can really follow along with us each week on a journey of learning that we are going to be embarking upon. So please join us, check out the links in the chat. And thank you all again so much for having me today.
Lindsay, amazing. I know the work that you are doing over there is so relevant and so timely. I'd love to hear now from Elliot. Elliot, are you there?
I am. Hello.
Hi.
Thanks for having me. Hi, all. I'm Elliot Hinkle. I use they, them pronouns. I'm the principal and founder of Unicorn Solutions. Put my web link in the chat for you. So I'm connected with Angela Weeks, also a big fan. I've had the pleasure of working with her in the Soji Center on some different projects. And for me, I come to this work as a person with lived experience in child welfare, a person who has survived suicide as well as conversion therapy. I'm also a queer and trans person. So this topic is very important to me personally. And I think the sort of time period we're in has only made it more important that more of my work focuses particularly around LGBTQ youth and supporting them. Some of the work that I've been doing has been national. So it's been helping with national initiatives, trainings, webinars, podcasts, but also some of the work has been local, coming to specific local sites to figure out what do they need, what's happening as challenges in their support for LGBTQ youth. And especially thinking about rural spaces, sometimes the spaces we either forget about or just aren't quite sure how to support because they don't have all the same resources as bigger metropolitan areas. I grew up in Wyoming in foster care there and as a queer person and survived some not great things. And so for me, it's been really important to return to my hometown in Casper, Wyoming, and provide opportunities, program, education, and insight, things that I can give back to a community that doesn't always get invested in. And in doing that, what I've learned is the impact of things that Angela mentioned, like the fear that comes from policy and legislation. Even if that policy and legislation doesn't pass, what I've noticed in some of the emails that I get from concerned parents or young people is confusion about what is a law now and what isn't. And I think what it's doing is creating a place where people are sort of frozen and not sure what to do, which means I think it is behoove us to do everything we can to make it clear to people what is a law and a policy right now, what isn't, and how can we support making that as clear as possible for folks? Because even without having that sort of clarity, and without those laws even passing or policy changes, it's created enough confusion that it's impacting folks' mental health. It's impacting the fact that folks are migrating from states that are not affirming to other states that might be more affirming. And even in seeing that, what we're noticing is a flood of folks seeking gender affirming care in other states that have it, but then it overburdens the wait list. So people are looking at quite a few years to access medically necessary life-saving care. So again, these things all trickle on to other challenges, right? Like folks' mental health are struggling to sort of stick around. So I think it's important that we connect about those things and work with folks on that. The other thing I would say is that coming from Wyoming, one thing we know is Wyoming is some of the highest rates per capita of suicide, especially when we think about youth. And a challenge in my hometown is that the school board hasn't really addressed this issue. And if they haven't addressed it for most students, that's almost worse yet for LGBTQ and BIPOC youth in places like this. So it's really important that we sort of challenge folks to take efforts on that. The other thing I would raise here is that it's really important that we don't stay silent. I think something that's happening in the news and general conversation about my community is folks are almost willing to say nothing because they're worried about saying the wrong thing or that it'll be too controversial. And I think what that actually does is feeds the idea that there's something about LGBTQ folks to be hidden or that there's something wrong with us when there's not. So talking about us, putting the word out there, making it clear that your program supports our community, has initiatives for our community, has opportunities for our community is really vitally important now more than ever. Don't just talk about us in our death, but help us live and thrive. Those are really important things. And when we look back at in 2020 and before, the amount of laws and policies that were happening were quite low, and now it has skyrocketed. And you can see that in a lot of reports. Last thing I'll sort of share is some upcoming things. There is a Safe Havens report that's a combination of work by myself, Children's Rights, Center for the Study of Social Policy, and Lambda Legal. That will release in May if you want to learn more about trans and non-binary youth and out-of-home care and the laws and policies, both the good and the bad. As well as I'm working on some rural LGBTQ support curriculum. So if you want to connect about training, education, engagement of people with lived experience, especially LGBTQ folks, please reach out to me at my website that's in the chat or my email address. Happy to work with you and just grateful for the opportunity to talk with everyone today. So thank you so much for having me.
Elliot, as we talked in the green room before we started, I went to your website and I was really impressed with the work that you're doing and the way that you think about things and the way you approach it. So I hope that others will visit Unicorn Solutions and check it out and know that you have support both from Unicorn Solutions and the SAMHSA funded LGBTQ Center of Excellence that's represented today by Lindsay and Angela. We don't have to do this alone. There are experts. We have them on this call today, and they are willing to help us. They want to help us. They want us to make the mistakes with them so that we can do it right for our audience. So let's use this. This could be your call to action. All you got to do is reach out to Unicorn Solutions or the Center of Excellence and say, I need help. We're not doing this great. I want to do better. And so let's really take advantage of that. We have people right here that have reached out their hand. Let's reach out our hand too and grab it so that we can do better. Remember, we want to make care feel like care. We can't do that. We're not all experts in this. So let's reach out to the experts. All right, let's move on. So next up is our very grateful to SAMHSA, who's funded the Crisis Jam and is really leading us on our journey. And happy to welcome forward Jill to talk to us today about some stuff that's going on at SAMHSA. Welcome, Jill.
Thank you, and good afternoon to all the Crisis Jammers. I have a brief update today on some exciting things happening or that have happened here at SAMHSA. The main thing I wanted to report on today is our recent Crisis System Design Policy Academy, and the 988 office partnered with the Crisis System Response TTAC to host a 2-day policy academy, which was held April 1st and 2nd out in Tucson, Arizona. And thank you to all of our Tucson partners, Arizona partners, who were very instrumental in helping us pull this event off. The purpose of the Policy Academy was to support states, territories, tribes, and tribal organizations in coalition building, role clarity, and application of systems engineering principles to develop and improve their policies and practices throughout their crisis system. We had 17 teams to apply, and we were able to select 10 of those, which included Illinois, Kansas, Michigan, the Oklahoma Tribal 988 Work Group, Oregon, Pennsylvania, Puerto Rico, Vermont, West Virginia, and Wisconsin. And I will say that these were all very excited, active, and committed teams at the Policy Academy. Each team had 8 participants that represented cross-system key decision makers in their local continuums. And the teams were kind of developed based on the goals that the team or the local area decided were their priorities. We had wonderful lived experience presentations to kind of set the stage and the purpose for the event, and those were provided to us by 2 individuals from Hope Inc. out in Arizona. We had a presentation on change management and how to map systems change and design. We had a wonderful presentation by Dr. Balfour on connecting a qualitative framework to crisis services, and she is always a wealth of information on how to take data and use that for quality improvement and strategic planning. We also had a presentation on how to embed equity across the crisis continuum, reminding the teams that equity needs to be a consideration from the beginning and not something like cake icing that you put on after everything is done. It has to be embedded and baked into the system. We also had presentations on children, youth, and families in crisis care, and some expert panels on crisis sustainability and financing, which is information that all of the teams were very, very interested in. And we had representatives from several national partners on ways that states, tribes, and territories can partner to advance their crisis system. And representatives were from NASHMD, NAMI, the National Council, and Vibrant Emotional Health. And each state developed their own action plan with anywhere from 1 to, I think the most were 5 different goals. And all of those goals were centered around developing sustainability plans for their crisis continuum, establishing, a lot of them were working on how to establish statewide crisis response services, and then several were planning to work on enhancing their partnerships between 988, 911, law enforcement, and the criminal justice system. Each team was assigned their own facilitator who worked with them pre-Policy Academy and will continue working with them post-Policy Academy to kind of put legs and hands to their action plans so that they can move from just being a goal to being an actual accomplishment. So I'll stop really quickly there about the Policy Academy in case anybody had questions, and I'll kind of look in the chat for questions as well, because I know my time is wrapping up.
Jill, thank you so much. And I love the pink shirt. I love the solidarity with our goals today. Wonderful. So let's move on to Megan Hope from Nashville. Love to hear what's going on in Nashville these days.
Well, thank you so much, Amy. You know, there is so much going on. And when I really look at what was talked about today, I'm really deeply moved. And I'm reminded of the 2023 Surgeon General Advisory on the healing effects of social connection and community, and how Elliot and Lindsay and so many people on this call create that sense of social connection and community, and how much we want to create an environment of well-being, that this learning community, this crisis jam, is that learning community, is that connection, and how there's that deepest desire to create services that not only feel like care, but also create a sense of well-being. I'm obviously very moved because it hits a core on what it's like to feel a sense of well-being. And the solar eclipse this past week was one of these shared experiences across everybody, in the sense of if you were there and you saw the totality, everybody was there, everybody saw that. And it was sunrise, or looked like a sunset on the horizon. Suddenly, there was one sliver of light, and then it became dark, and then it became light again. And it was such an awe-inspiring experience. And I was reminded of my own humanity, our humanity, that we're, you know, there's something bigger than us. And so I wanted to just bring that reminder today because of what's being talked about, and supporting LGBTQ communities, as well as the people that support them. So thank you.
Thank you so much. I feel your movement myself. Appreciate your pink blazer also today as you're with us. But you're right. There are these moments where we need to just pause and remember we're all humans and we all want to be connected. And that's kind of what we're working on in this jam. All right, let's move to our state updates. I'm going to pass it first to Shelley Polanco.
Hi, sorry, I couldn't find my mute button.
That's okay.
So quickly wanted to give an update. The map will be changing hopefully soon. We have one more state that is looking at incorporating a fee bill. So Maryland has two bills right now, House Bill 933 and Senate Bill 974 that passed both chambers and have been that has gone to the governor. The bill addresses 988 service definitions and requirements, as well as establishing a fee, a 988 fee of 25 cents. So hopefully we can get some, change the number to a 9 and see more states kind of finding more sustainable funding for 988. So I'll kick it over to Stephanie Pasternak. Don't see her on my screen.
Yeah, no, thanks, Shelley. Yes, very exciting news from Maryland. Very much hope to see the governor act on that bill in the next couple of weeks, and then we'd have our 9th state with a 988 telecommunications fee. I wanted to talk about a couple other bills in other states, starting with Wisconsin. There is a new law there, AB 467, Senate Bill 462, and this is really about the pillar of the crisis care continuum, a safe place to go. This establishes crisis urgent care centers in the state where people can go for assessment regarding mental health, substance use, and any kind of medical needs. This new law gets the first 1 or 2 centers off the ground, but the ultimate goal here is to have one of these centers available in every region of the state. And then moving over to Connecticut, I wanted to flag also a newer bill there, Senate Bill 370. This would bring peer crisis respite centers to the state. The bill would create 8 of these centers, also a technical assistance center to support them. 3 of the centers, 2 I should note, are to be operated by and for specific populations, including one for the BIPOC community, one for Spanish-speaking people, and one for the TQI plus community, which is defined in the bill as transgender, queer, or questioning, intersex, or other gender identities. So this Connecticut bill has passed out of its first committee and hopefully will be headed for a Senate floor vote in the future.
All right, thank you so much. And for those of us who are looking for our call to action today, you might have heard it just now in these 2 legislative updates. Go Connecticut. If you're interested in the bill she just talked about, raise your voice to those who are in leadership. And when it gets funded, look to see if somebody in your neighborhood needs a job at one of these to really help these get off the ground, okay? So this could be your call of action, the legislative update. All right, let's turn over to Stephanie, who always brings us incredible interviews. Stephanie, welcome. Hope you're okay. I know New Orleans is a little bit breezy today.
It is.
How are you doing?
It's okay. It's okay. So
Okay.
far. Yes. So this is actually an article that's from the Vault. It was originally published, I believe, in November 2022. And I interviewed 2 people. I interviewed Kevin, who was 14 at the time, and Dr. Maisha Price, who at the time was the Director of Research Science at the Trevor Project. And Kevin shared with me that in the days leading up to the start of high school, he was feeling all the typical new school jitters. But Kevin's also transgender, and he worried that teachers would call him by the wrong name. And so to prevent this, he and his parents emailed the school beforehand, and they reiterated that Kevin goes by, his pronouns are he, him, his. But on the first day of school, his teachers called Kevin by his dead name, which is the name his parents gave him at birth. And he shared with me how that felt. So I'm going to read the quote. He said, "When I got home, I cried and talked to my parents. It was very stressful switching schools and to be in a new situation. So when teachers used the wrong name, it was pretty devastating. Dr. Price told me that LGBTQ youth face specific stressors, and this is important, not because of their identity, but because society stigmatizes them." And this is what she said. She said, "They're already experiencing the stress of being an adolescent, a young person. Then you add LGBTQ specific stressors like discrimination and being victimized." And I think what's important to highlight also is that Dr. Price said that when LGBTQ young people have affirming, supportive environments, their suicide risk decreases. And I'll send it back to you, Amy.
Thank you so much. I reread your article just in the last 24 hours, and it was as powerful as when I read it the first time. The first person account from Kevin, just walking us through his experience, his fears, what happened, and the support afterwards was really, really helpful. And also reminds me back to what Angela said earlier today about how important those, at least one of those aspects she pointed out to be at school, right? Yeah. A gender neutral bathroom, or she named a couple other things. I have to go back, but right. The point is, that's something we can do. Many people on this call are parents or on the PTA or are taxpayers, and their schools could use a little bit of a nudge around this. So that could be somebody's call to action today. So thank you for walking us through this again with this first person account. Really appreciated reading it again this morning.
Thank you. And actually in the article, Kevin had that same experience, and he talks about that as well. I also want to, and I'll add it to the comments as well. I interviewed Angela, and she gave really constructive steps as well that families can do and schools can do as well.
Wonderful. We can always rely on Angela to help us just know little steps we can take. They all add up. every single one of them. And there's over, 200 people on this call today. Let's all do something. All right. Well, thank you so much, Stephanie. Always a pleasure to see you. All right. So last time I hosted, I was not a good host and I ran out of time for Vic. And I felt horrible about it for weeks afterwards. So David Covington gave me another chance. And here it is. I'm delivering finally on time so that I can hear from Vic. Vic, I hope you're here. We love to hear from you.
I am here and I have on my pink shirt on top of it. So April is National Minority Health Month, and this annual observance builds awareness about the health disparities that persist among racial and ethnic minority and American Indian, Alaska Native populations, and encourages everyone to take action to end these inequities. And as I've listened to much of what has been shared today, I'm convinced that many of the challenges that face Black and Brown communities are even more exacerbated by individuals who have the intersectionality of being Black or Brown, but also identify as LGBTQ+. This year's theme, Be the Source for Better Health, challenges us to focus on understanding how the unique environments and cultures and histories and circumstances known as social determinants of health impact the overall health of racial and ethnically minoritized communities. Key messages include taking action to improve health outcomes, convening by bringing together stakeholders to address health disparities, recognizing the impact of cultural context and social factors, commitment to equitable and respectful care and collaboration, and working together to create healthier communities and a stronger nation. All principles that could apply to the conversations that we've heard today. Clearly, mental health conditions do not discriminate based on race, color, geography, sexual orientation, or gender identity, yet our resources do. How do I know this? Because we see stark differences in access to and utilization of treatment resources by individuals who identify as LGBTQ+ and people of color. Interventions should validate and empower the end user, normalize their feelings, and empathize with the unique struggles they face regarding discrimination. Socioeconomic status is linked to mental health, and that people who are impoverished, homeless, or incarcerated are at higher risk for poor mental health, and people who lack access to care are at higher risk for poor mental health. We cannot ignore the impact of structural exclusion and social injustice, even in our mental health system today. Harsh words to hear, even harsher realities to live. Realities that have created a world in which people who identify as LGBTQ+, or people of color, or people with physical disabilities often feel like society does not value their lives, at least not enough to ensure equal access to care. Equity in mental health is about the intersectionality of race and culture and ethnicity and socioeconomic status, geography, sexual orientation, and gender identity, in addition to living with mental health challenges. Providing safety and connection for those who identify as LGBTQ+ during times of crisis requires seeing the whole person that we're helping and letting them be their full selves. Our services should offer validation of one's identity and reaffirm that you matter, your life matters, your pain matters, and you are not alone. While taking action to improve health outcomes and convening by bringing together stakeholders to address health disparities, recognizing the impact of cultural context and social factors, and commitment to equitable and respectful care and collaboration, working together to create healthier communities and a stronger nation. While all this sounds like a bold and visionary endeavor, isn't it really just a question of humanity and treating people with humanity, human dignity, and respect? When patients are provided with the culturally and linguistically appropriate information, they're empowered to create healthier outcomes for themselves and their communities. And when they are engaged in the visualization and formation of treatment resources, they're empowered to create healthier outcomes for everyone. And when one's identity is validated, They have hope. And that is Strong Talk.
Always worth the moment to see you, Vic, at the end. Now,
Thank you.
I'm going to do something that's unusual now. I'm going to take down the slides, and I want everybody who has any tidbit of pink on to turn your camera on so that we can take a picture of all of us together who are showing our strength for today on the International Day of Pink. So you've got your pink on, turn that camera on. How can we, organizers, how can we make Vic and I a little smaller and everybody else a little bigger? Can we somehow do that? Is there any way we can do that?
Well, I think if like when I switch to gallery, Amy, then I do see everybody. You may
Okay,
be still on
great.
speaker mode.
Let me do gallery. Okay, great. All right, so much pink. I love it. I'm going to take a screenshot right now.
Oh, and Karen is right in the middle of my screen.
I love that. Okay. Okay, I've taken a picture. Wonderful. All right. I hope we've got that. I'm so proud of all of us. Look at all that pink. Look at all of that. I love it all. All right. I'm going to go back to speaker and I'm going to roll up the last few slides that we have. What have we got to say here at the end? I know we got good stuff coming up. We had Vic. He was awesome, on point as always today. Next week, we have Jolie Long coming to talk about NBCC and the state compacts. Okay, one of our great new features, the big debate, is coming next week. And it's going to be Vic, who you just heard from, against David Covington, and moderated by Brian Sims. And we're going to talk about using the word emergency in lieu of crisis care. Let's come hear their arguments, see which side we land on. That's going to be really, really fun. Oh, that's April 24th. Maybe that's not next week, but it's coming April 24th. All right. All right. Let me just say thank you to Angela Weeks, Lindsay Smith, Elliot Hinkle for giving us data, resources, and an outreached hand today. We're going to grab your hand and we're going to take advantage of all you have to offer. Thank you to Jill Mays for talking to us about the policy work that's going on at SAMHSA and for the continued support from SAMHSA for all of us who have centers and who are working hard to develop resources. Thank you to Megan Hope today for reminding us about connectedness and how much we all need that. No matter what group we're in, we're all humans. Thank you to Stephanie Pasternak and Shelley Polanco for giving us a legislative update and giving us that hope from Connecticut that there may be centers coming that are specifically for some important groups. Stephanie Hepburn for bringing back our story about Kevin and reminding us what it feels like to walk through life with Kevin. And thank you always to Vic Armstrong, who always pushes us to think about all the needs of our group so that care can really be care. Appreciate being with you all